We're a few minutes ahead of schedule, which if you've heard me speak in the past, you know I'm challenged by timelines. But again, I want to thank people for attending. I want to especially express my gratitude to the people that agreed to be part of this symposium. And so I think I'll get started. It's pretty much on time. Look at that. So we hear a lot somebody's glasses.
Might be these.
So we hear a lot these days about existential this and that and whatever, and so I'm going to lean into it a little bit and say we really do have an existential crisis, and that is a global problem of malnutrition and associated chronic illnesses. We have heard from wonderful speakers this morning about Livestock's essential roles, and I absolutely agree that we should be doing things in a balance sheet approach. Someone once said there are no solutions, there's only trade-offs. And we're not good at evaluating what those trade-offs are because we don't have a balanced conversation. But food security and nutrition, economic contributions, agricultural stability, cultural and societal importance, adaptability to marginal lands, future resilience, biodiversity, ecosystem services. There's probably more that have been brought up, but I think that'll serve. I'm going to focus on nutrition and specifically human nutrition. And anytime we have as I've learned, anytime we have a conversation about sustainability, we need to be looking at a multiple grouping of factors. So economic, societal, and ecosystem, not merely one aspect of one of these, which unfortunately tends to be the public level conversation. And so I think those of us in animal sciences, those of us related to agriculture, we're focused ultimately on increasing human flourishing. But flourishing requires nourishing. I think we've heard that message clearly. I think the one that we really need to internalize is that cognition requires nutrition. And if I want to get optimistic about the future, what problems do I think 10 billion properly nourished human brains communicating together can't solve? I'm for Team Human. I think we have a wonderful potential ahead of us. But we need to recognize that there's some problems in a lot of the associated disciplines, and that those disciplines impact our disciplines. And the things that have been going on that were referenced at the very beginning by Dr. Belk have been going on for decades. And Francis Moore Lepay's book, Diet for a Small Planet, Dr. Place mentioned, unrecognized, is that book was cited as a reference in the dietary goals, which was the report out of McGovern's Senate subcommittee that purported to tell us how to eat healthy. And if you're familiar with the book, that should scare you. Health messaging is based on arguably flawed premises. Conversations about food systems and sustainability, and I put scare quotes around conversations because they're usually not true conversations. Policy visions, research priorities, we can increase the list. And we need to be aware of these scientific controversies that are not being resolved scientifically. And in many cases, this has never been about science. Science will be necessary, but it won't be sufficient to get us to where we need to go. Okay, enough. This paper was mentioned by Dr. Belk earlier. Please read this to get an idea of what's been going on, and you can add your own experience perhaps. Forgive me for reading the entire text of this slide, but I love it. Meat does not cause disease. In the past, many erroneous beliefs have held regarding meat as a contributing cause to disease. Meat has been blamed for a long list of diseases such as kidney trouble, rheumatism, high blood pressure, cancer, hardening of the arteries, gout, etc. In the light of the new knowledge of foods and diet through careful scientific investigation, these old theories not only have been discarded, but in many cases, meat has a place in the treatment of the very diseases which it was once said to cause. This is from 1933. How did we get from there to here, where you might repeat that list or hear that list repeated today and have meat or other animal source foods implicated as a cause or a risk factor for those diseases? If you're not familiar with that scientific or that policy, I'll try not to be too hyperbolic, but it's late in the day. It's a scandal. And the industries that we've been taught and trained to serve have been vilified as the cause of disease. How can we need to understand this as part of the landscape that we're operating in. This is how bad it is. This is, I hate to bring up any bad memories, this is Leninger's Principles of Biochemistry, specific page, okay? 2 questions, what makes fat tissue fat? What makes people fat? Those 2 ought to have the same answer. Not in Leninger's, not on the same page. It's not even a half page different, and they have 2 contradictory statements. This is how bad it has gotten. This is, okay, moving along. Nutrient dense is a phrase you will frequently hear. Understand it has an official definition per the United States Dietary Guidelines. I quote, well, I won't quote. I'll just point you to the highlighted text. Fat-free and low-fat, lean, and as little saturated fat as possible, because they don't consider fat a nutrient. And so the presence of naturally occurring fats in foods can only dilute the essential nutrients that they believe are in those foods, or what they perceive as essential nutrients. Okay, so understand that if you're talking to somebody and they're talking about nutrient-dense foods, you need to understand what they mean by that. Because we can use the same words and mean very different things. But when they use them, this is from the last Dietary Guidelines. This is one of my favorite slides. Let me spend a little time describing it. Here on the far side, well, on the bottom is the typical choice. And then they have what they're suggesting as the nutrient-dense choice that would be better. And so let's start, the farthest away from me is frosted shredded wheat. That would be the typical. And they say shredded wheat would be a nutrient-dense version. Let's come a little closer to me. It says butter at the bottom. I would wonder how typical butter is in the American diet anymore after half a century of promoting a hydrogenated vegetable oil product. But they say that's typical. Vegetable oil is their nutrient-dense alternative. And the one that just shows me that we're not having a serious conversation here is soda is their typical, and sparkling water is nutrient-dense. Now, I'm just an agronomist, so you're going to have to help me understand how sparkling water is nutrient-dense, in the meaning that I think most people would take it as, not in theirs. Okay, so understand that is an issue that's reflecting other issues. Here's another one. The dietary guidelines have been, their suggestions on a healthy diet are built around ounce equivalents of protein. First of all, it's crude protein. I do stand in front of several hundred physicians routinely and have to tell them why crude protein is not an appropriate metric for human nutrition, but we don't have to do that today. We have these suggested amounts of other protein foods that would provide an equivalent amount of protein to 1 ounce of cooked meat. Okay, but then there's a problem. The metabolic equivalence of these varied protein food sources has not been established. The basis for considering these protein food sources to be equivalent is unclear. And these equivalent protein food sources do not appear to be equivalent in any respect. And the dietary guidelines as proposed for the next revision is not going to address essential amino acids. In fact, they're going to argue subject to whatever changes are going to happen, but the suggestion was a further reduction in animal protein consumption in the healthy diet. Based on, it's a good question. Once again, it's political, it's not scientific. And then we need to understand that their philosophy is this is a diet for people to eat to stay healthy. So from 2010, 2015, and 2020, you can get the following three quotes. Beginning with, though they, the recommended USDA food patterns, have not been specifically tested for health benefits. Well, that's a remarkable statement for a document that's going to tell us how to eat to be healthy. Okay, next, the dietary guidelines is not intended to be used to treat disease. Okay. The dietary guidelines is not intended to be a clinical guideline for treating chronic diseases. Now, as an agronomist, I interpret this to say, eat this way, you won't get sick, but if you get sick, don't eat this way. Maybe I'm missing something. But given the fact that statistically speaking, sick is now normal in the United States, this at least ought to open up a conversation about, okay, how about a therapeutic disease for people who are now metabolically ill? We frequently see this kind of list of by 2050, and if you've been speaking for any length of time, you have to keep editing the slide because it keeps getting closer and closer. Let me focus on this one just to make another point. 66% increase in demand for animal protein. Again, I wanted to shout amen to Professor Adeshogan's point about it's a package of nutrition. It's far more than protein, and we haven't been speaking about protein properly, so there's a number of issues there. But what's that based on? Well, it's partly based on this increase in demand. Partly increased based on the idea of an increasing population, yes. But it's also based on the idea that as populations become more prosperous, they're going to be able to afford and purchase more animal source food. And I ask the question, are there counterexamples? And yes, we can look at colonial North America. We can look at a continent that was populated by largely impoverished Europeans who suddenly had unimaginably greater access to animal source foods, and they ate them in abundance. And their children became several inches taller than them, which is a marker for increased strength, which is a marker for increased productivity. So much so that when they showed up in Europe for World War I, people were amazed at the height of the doughboys showing up. Now, were there other things involved? Obviously. Again, it's not a simple answer. But in this case, you could say that the greater availability of animal source foods preceded any economic prosperity. What if that were the case in other countries? Okay, the words we use. Malnutrition is typically divided into undernutrition and overnutrition. When people working in these fields talk about them, we've heard that already today. I just want to point out that overnutrition implies excess, and it's thought to be the cause of obesity, which is then thought to cause or lead to chronic illness. This reflects calories in, calories out thinking, which is a flawed model for human nutrition. Metabolic health and carbohydrate insulin model suggest a change in the definition. So let's redefine it as any diet that evokes metabolic derangements. We can avoid all the diet wars. If somebody becomes metabolically ill on a diet, that diet is a form of malnutrition. Well, here's one paper. Approximately half of the total protein intake by adults must be animal-based to meet non-protein, nutrient-based recommendations. So that's only 65 to 75% of humanity that falls within that category. Here's a challenge for us. How are we going to help humanity produce sufficient animal source foods to meet a target like this? Here's another, and it was mentioned in Dr. Place's presentation, rapidly increasing deficiencies in populations consuming less than 30% of calories from animal source foods. Once again, that's about 60 to 70% of humanity. And lest we think that this is only in the low and middle income countries, per food disappearance data, you have to be careful what kind of data you're looking at. This suggests 29% in 2010, 29% of the calories in Americans' diet were coming from animal source foods. That's below that 30. Should we be surprised that we're seeing an epidemic of chronic illness? Maybe animal source foods are not part of a balanced diet. Maybe they're the foundation of a balanced diet. Balanced itself is a problematic word. Who's defining it? What does that look like? Is it really restrictive to talk about cutting sugar consumption in the United States by half, when that would still be 7 times more than they consumed at the turn of the 20th century? From the 1800s to the 1900s. Again, what's our reference point when we're having balanced conversations? So we have this, I'm suggesting, bigger challenge of this epidemic of chronic illnesses worldwide. But let's look at just the United States. About 60% of US adults have at least one chronic illness. 40% have 2 or more. 90% of the nation's $4.5 trillion annual healthcare expenditures go to these diseases. By 2050, more than half will have at least one chronic Americans over 50 or older with at least one chronic disease will essentially double. And we'll see a similar increase, 90-some% for those with 2 or more. So it's not going to get better. And again, this is a global thing. 3/4 of global deaths are due to non-communicable diseases. But maybe there's a root cause we can look for. That would be good news. Here's a quote from Professor Jeff Volek from The Ohio State University. The reality is, when you look at most chronic diseases, they have an underlying metabolic impairment as part of their pathophysiology or pathogenesis. The fact that I was able to pronounce those both properly is another quote from a biomedical researcher from BYU. Virtually every chronic disease has some connection to insulin resistance, where the insulin resistance is either explicitly causing the problem or it is exacerbating it or accelerating the problem. Okay, let's take that kind of information forward. We have a tsunami coming. It's actually here already. Non-insulin resistant hyperinsulinemia death, malnutrition deaths, you're looking at 2 to 3 million deaths a year. You broaden the definition to include hyperinsulinemia, insulin resistance, and we're now up to essentially 30 million. We'll increase that value by a factor of 10. And so that would include diabetes, cardiovascular disease, many cancers, dementia, mental illness. There's a list of other illnesses that are all now being investigated as somehow related to insulin resistance and hyperinsulinemia. Why is that important to the livestock industry? What macronutrient raises insulin? What are the 3 macronutrients? We've got protein, we've got fat, we've got carbohydrate. Carbohydrate is what drives insulin levels with genetic variation in individuals, but it's carbohydrate content. So the healthy diet today, prescribed by USDA and HHS, has been 60% of calories from carbohydrate to a population that's arguably insulin resistant. Okay, never mind. So let's get back to our buckets in sustainability. What's the societal impact of having 60 to 70% of humanity being malnourished? We can come up with lists. We've heard some of these earlier from Professor Adeshogan. What's the financial? Because it darn sure has an economic impact. Annual healthcare costs and productivity decline, direct and indirect costs, global $6.2 trillion US dollars per year. What kind of research project could you have on a tenth of that? US, $2.5 trillion. How about environmental? We're not used to looking at this one. We tend to give healthcare a pass when we talk about environmental impact. Should we? Just to treat global health related to malnutrition, we're in an area that's in the same neighborhood as the beef industry when it comes to global emissions. And then you can look at the other impacts. And we're not doing a really good job with that system. So we could have an interesting conversation there. There are other figures. There's one estimate I can pull from my library that says that the US healthcare industry is a significant source of pollution, including 10% of anthropogenic greenhouse gas emissions. I can pull out another paper that looked at the emissions intensity of the global pharmaceutical industry. And someone took the value from that and they looked at the average adult American with type 2 diabetes and said if they could eliminate their medication use, they would lower their carbon footprint because they're eliminated the medication, lower their carbon footprint 29% more than if they shifted from a high meat to a vegan diet. Okay, those are the numbers. We can argue about them, but maybe we should be spending some time looking at these things and finding ways to form interdisciplinary teams to explore this area. It seems to me like our conversation about sustainability stops before we get to the human beings we're sustaining in our food systems. So here's a quote from WHO: "Death is inevitable, but a life of protracted ill health is not. Chronic disease prevention and control helps people to live longer and healthier lives." There's a radical statement. But why is there no mention of remission or reversal? Those are documented. Where there is no vision, there is no hope. And I do have a vision, and the speakers here this morning have shared their vision, and I'm encouraged by theirs, and I'm encouraged by the work that you're doing, and what can we do to move this forward? I will hear people say, we can't feed the world a diet similar to whatever, right, in terms of animal source food content. And I turn that around and say, we must. It's a moral obligation to our fellow human beings. Now, yes, we have to do it in a way that protects, maybe even enhances the environment, that allows the farmer to make a living. All those complex parts are part of this. But until we get the idea that there is no sustainable food system without animal source food as a fundamental part of it, until we get rid of the idea that shows up on lists of potential harms from too much animal source food, which is never defined, by the way. That's another thing I could go off. Sorry. So, like a green revolution in the 60s and 70s, how about we have a ruminant revolution? And no, I'm not going to say we don't have swine but I'm a ruminant guy, so forgive me for being specious in that way. Ruminant animals obviously have ecological advantages, and so this is what I want to speak to the general public about. This is how we're going to increase, sustainably intensify the production and efficiency of animal source food production around the world in places that it's desperately needed, but I don't want people to think that North America is one of those areas that, as we heard earlier, with where people are in terms of their actual diets, it's not that good. So, summary, there's a global epidemic of chronic illness, there's a common root, which is insulin resistance and hyperinsulinemia. This is malnutrition, and animal source foods are a fundamental part of the solution. Again, drug-free remission of type 2 diabetes is in the literature. If you want to see the papers, please contact me. I'm happy to share. I'm happy to introduce you to other research groups. That's kind of sort of what I do. So challenge. Again, we had a challenge earlier. Here's mine. What can we do? Well, as individuals, again, I'll point to the Dublin Declaration. If you haven't gone there, please do. Also direct you to the Denver Call for Action. And then educate ourselves. I have several sources that I recommend, and I'm happy to do that. As an organization, can we educate our members through some activity and their communities, the industries they serve, the institutions that they're a part of, the communities that they live in? Can we maybe imagine some kind of member screening? The vast majority of people who have metabolic syndrome do not know they have it. And because they have it, they're at an increased risk of heart disease and cancer and dementia, and infertility is primarily a metabolic syndrome symptom. There's a long list. We could talk, maybe something like that would be appropriate. I don't know, some organizations might be able to get involved in advocacy where that's appropriate. How would that happen? How would we imagine that? And then others, ideas, bring them. Let's see what we can do to move this forward. Because as I said, we really have to. We cannot continue on the path that we're on, and it's not well recognized what a train wreck it is. So thank you for coming today. Thank you for the speakers that came before. Everything I've said is my own opinion and should not be taken as necessarily theirs or this organization. And we do have a long period, which I hope I haven't transgressed too much, of questions built into the schedule. And all the speakers are still here, so if you have any questions for any of the speakers this morning, I invite them at this time. Thank you very much.